Hello, everyone, and welcome to this audio podcast. As part of the series, this audio podcast series, is part of the Storm Solar. This audio podcast, as part of the series, a chartered edition and evidence based edition. This audio podcast, as part of a stellular impeach, and this audio podcast, in this audio podcast and this audio podcast series as part of the Rupture feature and a audio podcast as part of a Storm Robotics production. In this audio podcast, I'm now looking at sort of the objectives, the objectives in aligned to works in aligned to peer-reviewed and published works, looking at understanding education for healthcare service users aligned to social media platforms. So in around the objectives of this sort of peer-reviewed and published works is peer-reviewed and published works uh, is peer-reviewed and published works. Uh, there were there in around this in around the objectives there were five main objectives of this peer-reviewed and published works. So number one, to understand which subjects or topics are most important to healthcare service users in line to chronic kidney disease. Number two, to understand whether education between the physical realm and social media as part of healthcare delivery can help join up care. Number three, to understand what topics healthcare service users or patients would like additional support on through social media. Number four, to understand what education should be included in CKD care and chronic kidney disease care internationally. And number five, to understand how healthcare could be more integrated in order to empower self to empower service healthcare service users healthcare service users. The This international investigation, or this international this sort of international study or works provide an understanding on a and sort of perspective from two social media platforms. One adult social media platform looking at healthcare service users aligned to the adult healthcare service users who suffering with varying forms of chronic kidney disease, and then a pediatric or young persons or young people a young people so a social media platform that also have a healthcare service users suffering with varying forms chronic kidney disease, chronic kidney disease, and also sort of irrespective of CKD, chronic kidney disease severity. So as part of the objectives as well, a little bit around sort of looking at topic tagging development and implementation. So topic tagging formed part of the objectives, wherein the team looked to identify sort of the most popular sort of popular themes themes aligned to terminologies in around the condition around chronic kidney disease between two social media platforms. So a little bit in around the tagging development and implementation aspects as part of this works, before a subsequent audio podcast will go into the sort of methodology aspects. So social media platform founders had discussions with the research investigator and research intern about with one of the leading research investigators and a research intern about how healthcare service users utilize the platforms, social media platforms, to share experiences. Topic tags and themes topic tags and themes were then coded. They were coded coded they were coded again sort of coded in aligned to where a social media platform, where one particular social media platform has a sort of a coding facility or basis wherein against sort of the most popular terminologies and themes, for example, sort of enabled the investigating team to uh, to um, to sort through the sort of most popular terminologies using this coding facility through the social media platform. So this was co-developed. The basis was co-developed between the research investigator and research intern to also appreciate which areas of kidney healthcare were most popular, utilizing the search facility through primarily the Facebook the Facebook social media platform between the two closed social media platforms. The team organized a co-developing meeting where it was decided that given that both groups or cohorts have global reach, it would be important to ensure that based on shared experiences, topics and tags, educational themes could be applied and then linked between the RPSG, between the renal patient support group and the renal patient support group or the RPSG and the kidney disease and renal support group or KDARS group for kids online population on social media platforms. This would then help gain the maximum number of tagged themes between the social media platforms, and the work aimed aligned to the objectives. The work aimed to tag as many topics as possible according to designated themes over a 1 month duration between the two social media platforms. Um, in the original manuscript, there have been there have been tables tables or schematics that highlight the different themes and topics in the publication, owing to the remit of the journal. The table and the information, the schematic, the schematic information is not had not been included, but listeners are welcome to approach and happy to sort of share the information the sort of tabulated information from the original works from the original works from the original works. So that draws this audio podcast to a close. Our subsequent audio podcast will delve into the methodology. We'll delve into the methodology in around this peer-reviewed and published works. This peer-reviewed and published works. So that draws this audio podcast to a close. This audio podcast as part of our audio as part of a Ztorm Solar. This audio podcast as part of a Chartered edition, an evidence-based edition, evidence-based edition. This audio podcast as part of a Stellular Impeach. This audio podcast and series as part of this the Rupture feature, and this audio podcast as part of a Ztorm Robotics production.